Okay, today I will demonstrate how to place a perio pack on a typodont. When we are in class, we will be placing this on each other, but I felt this would be an easier way for you to see how to place it instead of trying to look in a camera in somebody's mouth. What you would need would be to have the material. You would have a base and a catalyst. You would have a mixing pad, a tongue depressor, which we would use to mix the material, a disposable cup filled with water. We will use this after we mix up the material. We would place the material in the water to help set it up. And then you would also use your PPEs. And again, I normally would have a mask on, but because the mask will mask my speaking ability, I wanted to do this without the mask. If you were going to work with a client, which you will during our clinic on this activity, you would have a mouth mirror, an explorer. You would also have the cotton pliers, a plastic instrument. This is a plastic instrument. You all have these in your setups. You would have gauze 2x2s. You would have an air water syringe tip and a saliva ejector. When you mix this up, I also want to show you, this is what it basically will look like when you place it in your patient's mouth. This is the after, and this is the before. So what you're going to do is you're going to take your catalyst and your base and you're going to put them on your mixing pad, and you're going to use equal amounts of the material. Oops. So that is the base material. And this is the catalyst. So equal lengths. This material is very sticky. So when you're manipulating it with your hands, I'm going to have you put on some petroleum jelly on your gloves, just so the material doesn't stick to your gloves. What you're going to do is you're going to mix these two together until it forms a homogeneous color. You mix for about 30 seconds until it's uniform in color. And then you get it all together, sort of scoop it all into one area and scoop it up onto your tongue depressor. Then you're going to put the whole thing in water and you're going to let it sit there for about 15 to 20 seconds. While that is setting up, I'm going to take the mixing pad that I just used and throw it away. So after about 15 to 20 seconds, you can take it out and feel it. You can see it's sticky. So we're just going to let it sit there. In the meantime, I'm going to take a little bit of petroleum jelly or a type of lubricant, any type of lubricant. Rub it on my gloves. Now I can touch this without having it being too sticky. I'm going to take this material off the tongue depressor, and then I can work with this. And what I'm going to do is I'm going to roll it so it looks like a pencil or a worm or whatever. Okay, you can see what it looks like. Then I'm going to place it in the mouth. This is the hard part. When you place it in somebody's mouth, you have to make sure that you have the area dry. If it's not dry, the material won't stick to the tissue. On this typodont, his tissue is dry. So I'm going to push it against the tissue like I'm locking it in. I'm locking it interproximally, you can see. I don't want to have it on the occlusal plane. When you're working with the patient, you can have the patient close their teeth, occlude their teeth, and then you can see where the teeth touch, and then you can just take your plastic instrument and take off the excess. This is sort of like a Band-Aid. You would put this on after periodontal surgery or some type of surgery that the patient had. You could take your plastic instrument, and then you would want to force that material farther in approximately, so it sort of locks that material in between the teeth, so it makes it stay there longer. Because typically the patient would have this PerioPack on for about a week. You can see how I'm pushing this in approximately. You can see right here that this is on the occlusal surface, so I could just take this material and take it off. I use my 2x2 to take off the extra material off of my blade of my plastic instrument. You can see that it is still pretty sticky. This looks really easy when I'm doing this on a typodont. It's not as easy when you actually have a patient where you have to control the tongue and keep the area dry. But at least you'll get a really good visual of what the expectation is. You would not want to have the material so far down into the mucobuccal fold that it would obstruct the patient from chewing or talking. If that happens, if you have it down too far, you can take off excess material. And you want to make sure that you get it off on the lingual surface of the teeth, because as the person is eating or talking, they're constantly moving their tongue, and if they are doing that, what happens is it will dislodge that PerioPack. So you want to make it as easy and comfortable for the patient to maintain that PerioPack on those teeth for about a week. And I do also want you to remember that typically you would have, underneath here, you would have sutures. So if there was an extraction or periodontal surgery, there will be sutures associated with this. And as you're packing this onto the tissue, you're also packing it onto the suture. So when you remove this after a week, you would want to be very, very careful when you're lifting this up and make sure that the sutures are not attached to this, because if it is, and you take off that, let's say the buccal surface of that PerioPack, it may not come out because it's stuck to the sutures that are also sutured into the gingiva, so be real careful with that. Okay, now that the PerioPack has set completely, we're going to remove it from the tissue. It will be easier to remove in the patient's mouth than it is from the typodont because of the saliva and the warmth. Okay, what you're going to do is you're going to take an instrument. It could be an Explorer, it could be a plastic instrument, and you're going to start from the occlusal surface down, and you're just going to separate the PerioPack from the tissue. You can see that it's coming out interproximally. You're just going to peel it back. And again, this is a little bit more difficult because of the typodont. You can see that it is starting to peel back. We would like it ideally to come off in one piece. If there was a suture, you would back this material out until you could look down and see that there's a suture attached. If there's a suture attached, then you would cut one end of the suture as close to the tissue as possible, and then that suture would be removed when you took the PerioPack off. So you can see, you can sort of back it off. If this was in a patient's mouth, this would fall into the buccal mucosa. Then you could take your cotton pliers and remove it, or you could just take your finger and reach down and take it out. I'm going to turn the typodont around so you can see it from the lingual. I'm going to back the material out, the PerioPack out and away from the tissue. Be real careful that you're not next to the tissue, because it will hurt the patient if you miss and take your instrument and go down into the tissue. Again, you're just going to back the material off. If there is no suture associated with this, then your material may just come off in one big piece. That's ideally what we like. Then you can take your instrument and then take off any extra periopack that still is in there. I will caution you, if you have a patient that has just had periodontal surgery and they had a periopack placed because of that, had flap surgery or some type of other surgery, you do not want to take your air water syringe tip and blow cold air or cold water down onto that surface, because typically the gingiva is more apical than it used to be, so the root surface is exposed, and that can be very, very sensitive to cold water. So what you could do is, if you wanted to use your air water syringe tip, I would suggest that you put the air water syringe tip underneath the tongue and put a little bit of water underneath the tongue and let the patient warm that up before you have them swish it. So at least the water will be warm enough for them to feel comfortable in swishing that around in their mouth in order to get out little pieces of material that is still left. You could also take a 2x2 and wet that with warm water and then rub the periopack off of the tooth. Okay, well that ends this session on how to remove a periopack.